I know I said the bar was in hell, but apparently there are a few steps below it because it's about to get even worse for these 9 states, including Virginia, when Trump signs his tax plan into law. Tag a friend. Your states have something called a Medicaid expansion trigger law. I know, it is as bad as it sounds. Back when Republicans pretended to care about covering people's insurance, there was a push to subsidize the cost of insurance for people who weren't covered through their jobs. Like their job didn't give them health insurance and they needed health insurance. And 40 states agreed to do this in an effort to drive down the number of insured people in the United States. In exchange for covering all those people, the federal government's like, we'll pay 90%. And the states are like, cool. But in an effort to compromise with Republican state lawmakers or to appease Republican governors, in these laws, they wrote language that said once the government stopped paying that 90%, that the states weren't going to subsidize. They're like, don't look at us. We're not paying for shit. Everything was going fine until those meddling Republicans and Trump had to pass their tax plan, the bad, brutal budget bill. When that goes into effect, the threshold that the federal government is paying, that 90% number, is going to drop, and almost every single one of these states is swiftly going to kick those people off their health insurance. 630,000 people in Virginia alone are going to be immediately impacted by this. Would it surprise you if I told you that 6 of these 9 states that have trigger laws where people will immediately lose their healthcare coverage, would it surprise you if I told you that they chose Trump in 2024? I didn't think so. So now what do we do? Start by selecting candidates who have been proponents of Medicaid. Like Virginia, in November, you're going to want to look towards Abigail Spanberger because she has consistently voiced her opposition to Medicaid cuts. And if you think this doesn't matter, ask anyone in Michigan, because originally they were one of the trigger law states. Back in 2013, they had a Republican legislature and governor, and so they had language that made them a trigger law state. But they changed that because they had a Democratic governor and a Democratic legislature. The only way they could do that is by choosing candidates who wanted to make sure people had healthcare coverage. If you are in one of these 9 states, but especially if you're in states like Virginia, where they have a big contest coming up in November, be sure you're choosing these Democrats who want to make sure that you have healthcare coverage.